Hi, everybody, and welcome to Trendlines, a podcast on global affairs brought to you by World Politics Review. I'm Judah Grunstein, WPR's editor-in-chief, and I'm joined by WPR managing editor, Freddy Deknatel. Hi, Freddy.
Hi, Judah.
We'll be talking about the latest developments in the spread of the COVID-19 virus, initially called the Wuhan coronavirus, as well as global efforts to contain it. Before we get started, just a quick reminder for everyone listening that the interview episode of the podcast went live Wednesday. Elliot spoke with Cherian George about Singapore's recently enacted fake news law and what it gets wrong about the spread of disinformation and hate speech online. Freddie, obviously the COVID-19 virus has dominated news coverage over the past week or two. It's very clearly spreading now outside of China, although the number of cases still seems somewhat manageable and low. At the same time that there is now questions about whether it can be spread by people who are infected but without symptoms. There is also some cases now of it having been contracted by people who have no known contact with people who have traveled to known outbreak zones. So you see a lot of anxiety mounting. And I know from my personal experience when I'm reading the news in the morning and the afternoon and just going through the newswire, and it's like story after story after story of a new case or a new local outbreak zone, a new country with a first case. Now, again, with the very important caveat that we're not medical experts, and anyone listening should not be considering that anything we say should be considered medical advice or anything like that. For you personally, are you alarmed at this point in terms of the spread of this virus?
Yeah, I don't know how you couldn't be at least a little alarmed, just seeing the spread of it in China first, and now outside of China. I mean, the vast majority of confirmed cases are still in China, but it is certainly spreading. I think the bigger concern is with government responses so far, and at least here in the United States, where the Trump administration held this, press conference last night, Trump's first ever press briefing from the White House's briefing room. And he was deliberately, directly downplaying the risk of coronavirus spreading in the United States, almost simultaneously as people from the CDC and from the NIH were saying the exact opposite, not, hyping the threat, but saying very clearly that cases will grow in the U.S., just the very straight, sober information that you want from public health officials facing what could be an outbreak or something like this. And I think that that's the bigger risk, is that whether countries are really prepared to handle it. And I think, at least here in the United States, that's the biggest risk, because Donald Trump, you have a sort of extremely unusual circumstance where you have a president who is trying to essentially say the opposite of what experts in government are saying.
It's really clear that the officials responsible for this, and especially not the political appointees, but actually the experts and the people who have a granular knowledge of this sort of thing, they're in a very difficult position because they have to raise public awareness. It's very important. At the same time, they don't want to create a public panic, which is counterproductive. And in a lot of ways, just given the way in which the epidemic evolved in China and now seems to be trending toward becoming a pandemic in other parts of the world, you can see the argument for both sides. It seems like in terms of lethality, it's not a particularly highly lethal viral infection. Some people apparently don't get very significant symptoms. Some don't get any symptoms at all, it seems like. And at the same time, it's because of the fact that it's a new viral infection, we don't really have the kinds of numbers that we have for instance, the seasonal flu each year, which kills in the tens to mid, 10 to 50,000 people or 75,000 people a year in the U.S., I believe. So there's a case to be made for keeping the response measured. But at the same time, regardless of how lethal an infection like this ends up being, from a public health perspective, it's obviously very significant because and very important to limit the spread of the infection, because even if it's not fatal, it still requires quite a significant response in terms of healthcare infrastructure, in terms of resources. It has secondary impacts in terms of opportunity costs for where those resources might have gone elsewhere. So you might have a non-lethal virus that causes deaths from other illnesses that are treatable to go up because resources are diverted elsewhere. There's a cost in terms of daily life if you have school closures and things like that. So even for everything we still don't know about how big a threat the virus is to life, to human life, it's still a very significant challenge for public health officials. And to me, this sort of underlines one of the big challenges for policymaking in general, and something that we pay attention to at WPR. We often cover things like global public health governance and funding and structural reforms to improve it. But clearly, that's not the sort of thing that gets the headline attention in Washington, for instance, or at presidential debates.
No, it isn't. It isn't. I think that the bigger story, while we wait for more to be known about the extent of the virus, what we can look at is the responses from different countries so far and what that has shown. And I think more than anything, what's most troubling is that the kind of public health officials and doctors and experts who have tried to be measured, while also being, again, clear-eyed about the risks that this poses, they have been essentially shut down or rebutted by their own governments. And that's something that we saw in China with a doctor in the central city of Wuhan who tried to raise the alarm back in December and was basically, shut down by the authorities. And he later died of coronavirus and has now sort of become a sort of national hero in China to the chagrin of the authorities. But we've also seen that to a certainly different degree here in the United States, where Trump has tried to say that CDC officials who have tried to say it is inevitable that there will be more cases of coronavirus in the U.S. Doesn't mean that there will be an outbreak necessarily, but if there are 50 cases or 60 cases in the U.S., that health professionals are saying there will be more. And Trump has said he doesn't believe that. And then in Iran, for example, where Frida Gittes wrote about this week, which has now become the new sort of second focal point after China, because it seems like it is going to be incubating an outbreak in the Middle East potentially. It's the same situation where the government has very little credibility. It's a deeply closed regime. Nobody really trusts what they're saying, and it's been quite clear already that they're downplaying the threat of coronavirus and that they have deliberately been trying to sort of hide the number of cases so far, even though you have senior government officials who are contracting the virus and who have been on TV publicly showing symptoms. And I think that's what, at least at this stage, that's the bigger worry, is that it's showing the inability of governments to deal with a problem that they don't want to acknowledge as a problem. And I think that certainly, I'm not trying to equate Trump with Xi Jinping, for example. I mean, there's certainly different contexts, but I do think you do see some troubling similarities between governments that are trying to not just manage and deal with bad news, but try to limit it or try to claim that the news actually isn't that bad because they don't like what it means for them politically.
So I think first of all, it's a great point and a great parallel between the silencing of the Chinese doctor who first started trying to raise the alarm in China, and the undermining of expertise in the U.S. by Trump and political appointees to the administration. And I think it really highlights two elements that we discussed before recording. But one is this the consequences of what's been really a pretty steady campaign of demonizing expertise and sort of grouping expertise into this anti-elitism campaign, or targeting expertise in the same way that elites have been targeted in some of these populist political movements in the West. And the second, which is in tension with that and drives it in some ways, is the politicization of something like this, because it's inevitable that it happens. And by politicization, I think there are two elements to that. One is the fact that there are political consequences for governments based on how they respond and how they prepared and how they responded. And so I think when you see, for instance, in the U.S., when you see that in black and white on the printed paper of the Trump administration's budget requests, that they've cut the funding for the Center for Disease Control and cut the U.S. Contribution to the World Health Organization, you have very clear cause for questioning the foresight and the wisdom and the preparedness. And then as well, when a crisis does actually hit, once the initial human costs and the humanitarian aspect are addressed, there's always a political reckoning, and it's you see it in Iran, and I suspect we'll see it in the U.S. as well. And I think that and it ties into this question of demonization of expertise. It's become kind of cliche right now to talk about a Chernobyl moment, or to a lesser extent a Katrina moment in the U.S., but it speaks to events that, because of their concrete reality and because of the need to respond to them with people who know what they're doing and have expertise, and based on science or technology or some other authority besides political authority and rhetoric, when you have an event like that clearly shows that the political discourse or the political rhetoric of the administration is not connected to reality, it becomes harder to realign or to harmonize those two things, and it really then kind of creates a cascading effect of the public growing skeptical and beginning to question the authorities moving forward.
I think you can see it also in the, at least in the response here in the U.S., the sort of argument that the Trump administration has been leading with, which is to say that, amid criticism that the CDC, that they've tried to cut the budget of the CDC and that they've downplayed the risk and are only now catching up to it. The rebuttal from Trump and from political appointees is that no, they've actually taken extremely aggressive measures to close the borders and to limit flights from places like China, and that it's this very in keeping with a lot of other things Trump has done, but the idea that all that matters is that the borders are shut and that you can close yourself off from the rest of the world, even though the evidence shows you can't. And I think that even the World Health Organization has pointed out that they don't support those kind of extreme measures, that the measures that really matter are public health responses, are educating the public, dealing with just the very concrete ways to contain a viral outbreak, not closing borders and restricting movement of people that in fact often that really doesn't have as much of an impact as governments think. And yet I think it's very revealing that continues to be the Trump administration's main argument, to say, no, we're actually doing, we've been more aggressive, than any administration in decades in terms of trying to basically quarantine the country. But again, that flies in the face of the WHO's own recommendations of what to do in a crisis like this.
It's also useless in the face of the what seems a possibility now of invisible transmission, right? People who don't have symptoms, for instance, or who haven't traveled to, at this point, the country in question, China. Eventually, if there are cases that have sprung up around the world, it's hard to imagine that there will be no incoming flights to the U.S. But even if there are, it seems like it would like it's impossible at this point to screen everyone who might actually be carrying the virus or pose a risk. And I'll say this too, something I read in the past few days, I forget exactly where, but for all the questioning of the Chinese authorities' initial response, there was this suggestion that when they finally shut down and quarantined basically Wuhan and Hubei province around it, that did buy the world about 4 weeks or so. Of a really reduced threat of transmission and spread to pandemic status. And it doesn't seem at all like the world took advantage of those 4 weeks to really prepare. I've seen reports of faulty tests and guidance that, for instance, for who should be tested, that has left people who are at risk untested until it was too late, things like that. So I think that, again, we've been covering various aspects of global health governance, whether it's in the context of the Ebola outbreak and epidemic, whether it was SARS or swine flu, even going back 10, 12 years, and some of the best practices and what needs to be improved. And again, these aren't the topics that make headlines or that turn crusaders into stars in the way that, for instance, Mike Pompeo made a name for himself going after Hillary Clinton over the attack against a U.S. diplomat or embassy compound in Benghazi. But these are the sorts of things that the nuts and bolts of them are extremely important. I guess one last thing that I would want to mention or bring up and talk about is this question of credibility. You talked about Iran as a case study of poor response. It's also a case study in terms of a government that has really undermined its own credibility in the recent past with the downing of the Ukrainian passenger jet that the government denied the Iranian military was responsible for, and it later came out that it was. In the U.S. too, again, not comparing the Trump administration quite to that, but there's been 3 years now of Donald Trump and his administration and his cabinet appointees very clearly being willing to lie and to say things that aren't true for political advantage or to shape public opinion. And I think that this is the kind of crisis that exposes the real danger of the post-truth environment that people talked about, but also governments, and especially the U.S. government, if to the extent that it does, that embrace that kind of post-truth environment, because credibility is really hard to build and it's very easy to lose.
Yeah, I think that what we saw in the press conference that Trump gave and in other statements that he's made, just in the last couple of days, as this has become more of a potentially pressing crisis in the U.S., is that, Trump's default is to deal with everything like it's a campaign rally. And he does that for his own political advantage because it plays to his supporters, and it's part of a, sort of divisive strategy that has worked in large part for him well. But I think when you see at a moment like this, where people do need to look to the government for reliable sources of information and sort of reassurances about what they should believe or should not believe, or what is being overstated or understated, that's the farthest thing than what the Trump administration is putting out in terms of the sort of statements. You saw it in the press conference last night where Trump's default is to fall back and blame the Democrats and blame the media for, if not the coronavirus itself, then for the impact on the stock market. Because that seems to be Trump's main focus right now, is trying to contain shocks to the economy that are coming out of the fact that it's very clear that the global supply chains are freezing up and that there's going to be an economic impact. And so I think that certainly, this is there's been this question since Trump came into office about how would he really deal with a serious international crisis. And in a lot of ways, he dodged a lot of bullets, and even crises that did come up have never been nearly as bad as everybody sort of expected, whether that was, the brink of war with Iran earlier this year, or, we can kind of run through all the different sagas of his administration. But a public health crisis is very different because it's not a political crisis in the sense that, there's an easy diplomatic solution or that there's one way out of it. It's the kind of thing that it does require, totally nonpartisan and career people in government who are charged and have the expertise to deal with it. And that's really, in a lot of ways, the very people that the Trump administration and Trump himself have been demonizing throughout his presidency.
It's also, of all the crises that you've mentioned and that Trump has sort of weathered over the course of his presidency, they've all been self-created crises. This is the first one where arguably it's not self-created, although there is a contribution in terms of the lack of preparedness. You mentioned the importance of the credibility of government information and spokespeople and things like that, but the media too, right? The media is a very important disseminator of risk factors, best practices in terms of avoiding infection. Again, informing people without creating panic and things like that. And, when you have the Trump administration and Trump himself, who have just been beating this drum of fake news and generating this lack of trust in the news media, it undermines a really important partner in this kind of crisis. I don't want to frame the news media as being a partner of government. It should often be a critic and an oversight of government. But when you have a health crisis, a public health crisis like this, working with the media to promulgate and disseminate the most accurate information is really important. And Trump has really cultivated a lack of trust in the media over the course of his presidency, which undermines that. And to that effect, I really think I think of Elliott's interview, which went live Wednesday with Cherry and George, about disinformation and how it spreads online, and what governments can do to effectively combat it, as opposed to these kinds of fake news laws. I think it's a really timely discussion to this topic as well, even though it's seemingly unrelated. But this question of when you look at some of the conspiracy theories, for instance, that have been spread over the course of the Trump presidency and before, obviously too, but this demonization of the media and this willingness to just brandish everything that people disagree with and call it fake news. I think this is the kind of crisis and the kind of situation that creates a potential for a perfect storm that can backfire on the Trump administration in this case. And I guess for a last thought from me is there's also the politicization in a small p sort of way, the partisan politicization, and that's inevitable as well. And in a sense, you could say it couldn't have happened to a nicer guy, because when you look at Trump and his Twitter feed, for instance, during the Ebola outbreak in West Africa in, I guess it was 2014, and his criticisms of the Obama administration and the role he played in really whipping up a frenzy and a panic in the run-up to the midterm elections, the congressional midterms, he was really a focal point and a important node in that disinformation network. And so, again, there's always going to be some partisan politicking when it comes to a crisis like this. And the important thing for someone in a position of authority, I think, is to try to rise above that and approach it from a nonpartisan way, even knowing that it's sort of fighting with one hand tied behind your back, because of the importance of being a responsible sort of guardian of the public well-being. And again, on that score, judging from his press conference last night, Trump is coming up short as well.
He is, yeah, and it's hard to avoid the irony that, like you said, for all the criticisms that completely out of bounds and outrageous criticisms, really, that Trump was tweeting at Obama in 2014, and the question also becomes, why was he getting all this oxygen at the time? You remember that he was just this like Fox News personality who would call in and just ramble about whatever he wanted to talk about, but it got a public airing, at least among a certain segment of Americans, and now Trump is confronting a public health crisis again, and trying to do the things that he said Obama was so foolish for doing in appointing, for example, a czar, an Ebola czar, although in that situation the person that Obama appointed was, by all accounts, an excellent manager, and was the kind of person you do appoint to do that, not the vice president who doesn't really have any public health record to hang on. I think the other, just coming back to the disinformation question, is that Trump's going to have a harder time dealing with these criticisms, also because these conspiracy theories that you're mentioning, you're at least here in the U.S. you see more, at least reporting on them, that this idea that the virus is some Chinese invention or it's all some anti-Trump plot, which again also echoes in some ways what you see from the Iranian regime, that this whole thing is an anti-Iran plot. Again, that's not to compare them directly, but I do think that there are echoes in terms of these conspiracy theories. And Trump awarded, the Presidential Medal of Freedom to Rush Limbaugh, at the State of the Union last month. And Limbaugh has been one of the people leading this conspiracy theory that this whole thing is a plot to undermine Donald Trump. So I think that, when you have these kinds of people this close to the president, and you have these kind of people who are being praised by the president, that has a lot more of an impact in terms of the public messaging and how you communicate during a crisis like this.
All right. Well, hopefully the authorities and the officials responsible for the response in the U.S. and elsewhere can mobilize and make up for some of the lost time. And obviously, that's what everyone wants. And the political stuff is really more the second tier and backdrop, and clearly less important than the actual public health crisis. Okay, time to mention some WPR articles for everyone listening. Freddy, which one did you have in mind?
I was going to mention Elliott's latest article on whether the U.S.-South Korea alliance can withstand another Trump shakedown. As Elliott puts it, that mafia-esque terminology is apt here, given that Trump has made his initial shocking demand for a 5-fold increase in Seoul's share of American basing costs in South Korea, from around $900 million a year to nearly $5 billion. South Korea compromised to a point last year with some of the Trump administration's demands, and then now the administration, as we've mentioned in a previous podcast, has just upped those demands to the point that it doesn't seem like a deal can really be made. So it's purely just a gesture to try to get more money out of your allies.
And I'll mention Julian Hadam's briefing on how the recent death in police custody of a popular Rwandan gospel singer, Kizito Mihigo, has highlighted the public's lack of faith and trust in the government of President Paul Kagame. The authorities claimed Mihigo committed suicide, but that was greeted with skepticism by many observers due to an established pattern in Rwanda of Kagame's political opponents and critics meeting untimely deaths. Kagame has long gotten a pass from the international community on his repression of domestic dissent, largely due to the economic success story he has presided over in Rwanda. But as Julian writes, quote, 26 years after the genocide that killed an estimated 800,000 people, the turnaround overseen by Kagame no longer looks as simple as it is often made out to be, unquote. All right, two things I want to mention before we get to the Who Said That segment. First, if you'd like to stay up to date on everything we cover at WPR, go ahead and sign up for our daily newsletter at wpr.pub/trendlines. In addition to free access to selected WPR articles all week long, you'll also get a promotional code for a 25% discount on a WPR subscription. And second, if you'd like to drop us a line with questions or comments, you can email us at podcast@worldpoliticsreview.com. Okay, time for Who Said That? Freddie, what do you got for me?
All right, I'm going to take out the country in question in the quote, but here it is. He was a crook, but he was a real man, and he never humiliated this country, unlike the dark days we are living now.
I'm going to say it has to do with Hosni Mubarak and Egypt.
That's right. This was an Egyptian writing on Twitter after the government confirmed Mubarak's death earlier this week.
His oft-reported death over the years, there was some disbelief when it was first announced until it was actually officially confirmed this time.
Exactly. I have many memories more than 10 years ago or more of when I was living in Cairo that there were at least a couple moments where there, news of Mubarak's death spread around, and it was, gripping Cairo for an afternoon. And then, of course, it was just one of many that turned out not to be true.
All right, here's mine. I'm going to blank out the country as well. Is it the first time that a president changes the Constitution to do a third or fourth term? Why would it be impossible in blank to do 3 mandates? It's only blank that is criticized. Some countries can change Constitution 4 or 5 times without being criticized.
Oh, I don't. There's so many countries that we feel like we cover that have either presidents who are trying to change term limits or trying to change constitutions to let them run again or do other things in their favor. So I can't think of which one it is.
It's become a common technique. That one was Guinea's president, Alpha Condé, in an interview with a French daily ahead of a referendum Sunday that would alter the constitution to allow Condé to run for a third term, something the opposition there has been warning against and protesting for months now. The outcome of the referendum is still uncertain, but if it passes, it looks like Condé is tipping his hand. He'll probably be running for a third term. All right, great stuff. Thanks, Freddie.
Thanks, Judah.
If you'd like to stay up to date on everything we cover at WPR, go ahead and sign up for our daily newsletter at wpr.pub/trendlines. In addition to free access to selected WPR articles all week long, you'll also get a promotional code for a 25% discount on a WPR subscription. And if you'd like to send comments or questions, email us at podcast@worldpoliticsreview.com. Trendlines is produced and edited by Peter Dury. You can follow him and World Politics Review on Twitter, and you can find links to pieces covering the issues we talked about in the show notes on worldpoliticsreview.com. Have a great weekend, and see you next week for 2 new episodes of Trendlines.